one-third of patients prior to the pandemic came into the primary care setting with some sort of mental health diagnosis. But now with the pandemic, social isolation is at its highest, anxiety, depression is at its highest. We're seeing that 2/3 of patients are now appearing in the primary care setting with some sort of mental health indication. And that is a big deal, because the primary care doctor does not have the knowledge or the tools to really help the patient. And that's really what allowed Rose to really shine.
Hello and welcome to the Digital Health Cast, a podcast where we interview healthcare pioneers innovating modern day medicine. I'm your host, Dr. Mwata Dyson. During the pandemic, many of us have suffered ill health effects, and that's regardless of whether or not you've tested positive or negative, negligent to whether or not you've traveled to a really high risk area or recently developed a fever. I get it. In the news, especially the health news, much attention has really surrounded social distancing policies, diagnostic testing, as well as therapeutic regimens, all of which they should, especially if we want to get back to some form of normalcy. However, there are no nasal swabs, antibody therapies, or vaccinations for that matter, that will greatly impact one's mental health, at least not alone. And the reason being is because the problem is really compounded. On one hand, you have these really high infection rates. We're in an economic recession. We have prevalent distant learning, especially in communities and neighborhoods that really can't handle such heavy loads. And we have a widening gap in health equity. You combine that with the fact that many organizations just don't have the tools to assist, from hospitals to schools, from businesses to municipalities. They just don't have the resources to capture and treat those individuals whose mental health may have been negatively affected. We need better coping stress mechanisms in order for us to become a stronger community. That's why I'm happy to have with us as a guest on the show today, Mr. Kavi Misri. Kavi is the CEO and founder of Rose Health, an innovative health solution that aims to deliver reliable mental health care. Kavi, I want to thank you for joining us today. Welcome to the show.
Thank you, Dr. Mwata. It's an absolute pleasure to be as a part of your show, and looking forward to share the genesis and the story of Rose with you and your members.
Yeah, absolutely. So am I. I was talking to some colleagues earlier, obviously with us being in a pandemic, looking for creative solutions. And most of the conversation was guided towards things such as PPE, how do they better distribute vaccinations and better ramping up better testing. Where do I see mental health come to the table? So I'm really glad that you're doing a lot of the groundwork along these lines. But I'm really curious, what was that pivotal point for you where you felt that this was a sector that you wanted to dive into?
Yeah, that's a great question. And that is in regards to the genesis of Rose. Rose was ultimately formed about 2.5 years ago based on two realizations that I had. One was more so on the business realization, and the other was on personal realization. In my background is in healthcare investments, so I spent about 7 years working as a healthcare M&A investment banker, and then I transitioned over to an operator role at Northwell Health, where I worked to create and build our own health insurance company called CareConnect. And at CareConnect, that's where I really saw the importance of digital therapeutics and digital tools, and how it really impacted chronic conditions like oncology and heart disease, but also saw that there was a lack of digital tools and therapies available for mental health. And that clearly showed in our monthly meetings, where we would see that the monthly expenditure of mental health would increase about 5% month over month, due purely to decompensation of our members and also due to the fact of our due to leakage of our members going outside of our network, which defeated the purpose of our narrow network health insurance company. So saw that large business need there, but really what took it to the next level for me to actually form Rose was after working to the 80 to 100-hour work weeks for 7 years, I finally burned out, and I fell into my own depression when I burned out. And I learned very quickly that depression is not a passive state. It might seem that way to people on the outside, but to the person that's depressed, it's an active state of pain that really takes over your entire body, from the tip of your hair all the way to the bottom of your feet. And luckily, I had the wherewithal and the support to seek mental health care. And at that point, I experienced mental health care for the first time, and I was just blown away by the inefficiencies and not just accessing mental health care, but navigating the mental health care ecosystem as a whole. And I saw my fellow friends and colleagues experience similar concerns, and the stats, I wasn't alone. The stats show that 1 in 5 Americans experience some sort of mental health concern each year. And at that point, I decided to do something about it. So I leveraged my experience as an investor, as an entrepreneur, but most importantly, as a patient to build Rose into what it is today. And I've been super fortunate to have my fellow executives, Dr. Matthew Peters, Dr. Atif Adam, Johns Hopkins experts to lead the clinical direction and build the ultimate solution that would have helped me 3 years ago when I burned out.
Well, thank you for giving us both the business and that personal context. And kudos to you for seeking help when you felt like you needed it the most. Mental health typically is associated with negative stigmatism. So I would imagine that sometimes its effects are so subtle that many people won't seek the help that they really need. So I'm glad that you took that first step and then bridge from there where you were able to develop a platform where you were able to help others, that were kind of suffering from a similar situation. As you navigated through the process yourself, what did you find? And even now, as an owner of a digital health solution to this problem, some of the biggest challenges with the traditional mental health care model.
Sure. One of the things that we found was really the massive infrastructure challenges that prevent people from getting care, and that ultimately was due to the skewed ratio of the amount of people that need help and need care compared to the amount of clinicians who can provide that care. So there's a huge gap in that supply and demand ratio. And what we saw was that primary care doctors were really the first and only line of defense when it came to mental health for so many Americans, especially when we look into rural America, because the stats show that one third of patients prior to the pandemic came into the primary care setting with some sort of mental health diagnosis. But now, with the pandemic, social isolation is at its highest, anxiety, depression is at its highest. We're seeing that 2/3 of patients are now appearing in the primary care setting with some sort of mental health indication. And that is a big deal because the primary care doctor does not have the knowledge or the tools to really help the patient. And that's really what allowed Rose to really shine, is being able to provide a solution to help these clinicians augment care so that they can provide an antidepressant, they can provide a benzodiazepine, and in addition to that, they provide Rose, and Rose is that solution that really helps the patient. It empowers the patient. It provides that additional therapy for folks in rural settings or folks who just purely can't get access to talk therapy.
Yeah, absolutely. So access, a correct fit, and making sure that the user has adequate therapeutic options seem to be the services. that Rose Health is really helping to facilitate. Which markets or which cities are you in now? Are you predominantly in one area, or can you kind of explain where healthcare organizations and even physicians could utilize Rose Health?
Yeah, so we are focused on the primary care market as well as the ACO market. So being able to provide this solution to help primary care doctors as well as ACOs improve their clinical and quality measures while providing a solution to empower their patients. We have a few pilots in place. One with HCA Healthcare, working with one of their hospitals in providing the solution to their residents and fellows to help build mental health resiliency and to help prevent physician burnout. We have another pilot with Johns Hopkins where we will be providing the solution uh, to the Children's Hospital to help with mental health resiliency and offer that aspect. And then we have about 50 practices who are using this across the state of Florida, which is the state that we've launched into to be able to build and grow within the Florida market, and then working our way up into the Northeast to be able to expand as we continue to build.
Excellent. So if I'm a provider and I'm interested because I see a growing need with my clients or patients for that matter, help me to understand what I see from a clinical dashboard perspective
Sure, and I
and
think
how I use it. Yeah.
sure, yeah, and I think what may be helpful is how the patient uses it as well, and I can and share that piece. So at the core of Rose is our company's mental health patient monitoring app and provider dashboard, which uses patented AI and natural language processing to detect markers in speech and emotion to help identify early warning signs of depression and mood disorder symptoms. The platform produces a ROSE score, which is essentially a patient's mental health credit score. And based on the user's input into the app, it augments a clinician's caseload or a case manager's work to better care for the patient and empowers the patient with curated content for self care so they can build mental health resiliency and coping mechanism while outside of the doctor's office. Care managers, therapists, psychiatrists, and primary care clinicians would direct their patients to our Rose mobile app, which, by the way, is covered by insurance. And patients are empowered to communicate with their provider in and between therapy sessions, whenever and wherever they are, through telemedicine, journaling, and curated content for self care. And then Rose supports patients with individualized feedback and a patient centered experience. It simultaneously paints a clear clinical picture for clinicians, empowering them with data to hard to answer questions like, do you feel like harming yourself or others? It's truly innovative, and the early study results are promising. It provides a solution for the clinician to augment their care, to be able to see weeks worth of data in minutes. They're able to change the workflow of how they are treating that patients or seeing patients. So instead of spending 25 minutes on the how have you been question, you can spend 5 minutes on how have you been, because you already, while that patient is in the waiting room, you're going through, you're seeing the changes in PHQ-9, you're seeing the changes in GAD-7, you're seeing the variability in their mood and anxiety, you're seeing the journal entries, you're seeing all of that in a very visual manner. So you have a very clear picture of how the patient is doing. And with that data, you can then provide a more effective and a more clear clinical pathway to help that patient, whether it's by changing medication or reducing medications or talking about specific troubling times that the patient may not even recall, but with the Rose app, they can they can recall, and you can also see based on the input, the information that the patient enters.
Interesting. You know, a lot of times when you introduce new tools, it increases workflow duties, and it increases the amount of time doing non-patient facing activities. But I hear you saying that it actually saves you time, and you can actually be reimbursed. Is that correct? So the insurance companies are reimbursing for these type of services.
Yeah, so remote patient monitoring was supposed to be the top item and the top and the main. Yes, that's absolutely correct. Remote patient monitoring was supposed to be the top item in healthcare for 2020, but with the pandemic, it definitely made it the top item for sure. And what that has allowed Rose to do is to leverage remote patient monitoring codes so that clinicians can leverage leverage. So what that does is it allows clinicians to leverage these remote patient monitoring codes to look after the patient and to monitor the patient so that it prevents the decompensation of that patient so that they don't appear with further decompensation in the ER, which obviously is a further expense and a much greater expense to the health plan and to the payer.
I mean, well, that in itself is huge. I knew you were coming on, obviously, so I did a little research to get a better understanding of whether or not the amount of depression and other mental health issues have really escalated during these lockdowns. And one of the reports I saw stated that the rate of depression was had increased threefold. Right. So there are more people needing services like this. So the idea that you could decrease workload and possibly allow these healthcare providers to see more people seemed timely. But in from what you've seen, has this been the case? Have you seen a fluctuation or an escalation in people utilizing the services and an even greater need?
Yes, definitely. There's definitely been a need for health systems as well as practices, private practices that ACOs especially that are looking for specific programs like Rose that can help improve quality measures while also taking care of their patients and being able to see how their patients are either progressing or regressing and being able to leverage that remote patient monitoring on these patients and point and to that extent we've seen Rose has actually grown about 2,000% since the beginning of the pandemic. We just closed our seed round of our initial seed round of 1.7 million, and we are now fully running and going out there to gain market share and get more clinicians and more health systems using the platform. We've also seen the utilization rate jump up to about 80%. So there's definitely seeing a large engagement with the clinicians, with both the clinicians and with the patients as well. And the reimbursable aspect is nice icing on the cake for a product like this because it opens up a new revenue stream for clinicians where they are able to monetize the work that they're already doing. They just never had a tool like Rose that allows them to aggregate, provide a nice report at the end of the month of all the time that's spent on that patient that they can bill. And one of the great things about this is that the medical assistant does about 90% of the work. So it really allows for an easy approach for a clinician to really have flexibility in how they're using remote patient monitoring. And in one example, I know workflow is always an issue when it comes to implementing a new platform where clinicians always feel or the staff feel that it's just another tool, it's just another item that we have to do. But in this case, and what we've seen with some of our clinicians is that they are actually asking their MAs to come to work an hour before the office opens or come in on the weekend for an hour or two. And by doing that 60 minutes of remote patient monitoring every day for the 20 days of the month, they are able to get reimbursed for about 60 occurrences of remote patient monitoring, and that equates to about $10,000 in reimbursement revenue. So there isn't an actual ROI when we look at ROSE because there is no investment. It's just purely a new revenue stream that they're able to access.
Wow, that's amazing. Um, when the clinicians are taking a look at the dashboard, and you mentioned they can process data from multiple points. There was a questionnaire. I think you mentioned journaling, and then producing a roll score. And I like the way you put it. I think you said it was a mental credit card or credit score along those lines. Does it give any actionable items to the clinician? How do they utilize the data to make a decision on what to do next?
Yeah, so it's a great question, and that's the reason behind the ROSE score, which is the patient's mental health credit score. So based on the ROSE score, patients are risk stratified between a green phase, a yellow alert, or a red alert. So clinicians can see in their dashboard when patients are either progressing or, more importantly, regressing, going from the green to the yellow or the yellow to the red, and that's how they know those are the patients that they need to either reach out to or do remote patient monitoring with so that they're able to get them back down to the green alert, which is really just the sustain and the maintaining a positive mood. Obviously, the yellow and red alerts, which is something that we pretty much leverage from the emergency department, specifically for like sepsis alerts. Being able to have those alerts is instrumental for the clinicians to really know how to treat the patient, whether whether it's as simple as going into their profile and sending a message asking them if they're okay, or on the more of the more intense approaches of being able to get them or call 911 or be able to have them go to the emergency room. So the ROSE score is instrumental in being able to help with the care pathway.
Oh, that's amazing to have an emergency service built into the platform itself, really providing relief when it's needed. You mentioned a yellow, green, and a red, basically scoring system, a coloring grade. Does the patient or the user see the same output? Like, do they see a color coded grid as well?
They see a color grid, but it's not to the extent that the clinician sees. The patient sees a bar, a very simple bar, and it just shows their mood from green to red, and that's what they see. So to a certain extent, it isn't. It's brought on very likely to the patient to not to alarm them. But it just shows them their progress or how they're actually doing. Um,
Interesting.
so it does not show their ROSE score. The ROSE score is something that it's is in the back end of ROSE that really just allows for the proper care pathway for both the clinician as well as for the ROSE app to push targeted content.
Yeah, sure. And that sounds smart. I mean, to bombard individuals during a time of need with extra
Yeah.
data could probably just be
Mhm.
overwhelming. Um,
Yeah, and at one point too, actually. So it's specifically the way that we have it in the platform is just based on the mood. So it really just looks at we just show them their mood, how their moods have been since their last assessment. So going from great, which is green, all the way to awful, which is red. So they have an ability to see the changes as well, which I think is extremely important, but also, we have a system in place where every time you journal and you do a daily check in of your daily mood, your daily anxiety, you can see that calendar in your calendar, you can see red dots, you can see yellow dots, you can see green dots. So, and then you have the option of going in and reflecting. So you can see if 3 weeks ago I had 4 red days in a row, why was that? And then that's where you can now bring that up with your clinician, because patient recall is a major issue for all across the board for all verticals of healthcare. So by using rows, it's a way for you to reflect, and also your clinicians will see that as well. Your clinician will see that you had 4 bad days in a row. Therefore, they will point that out because more than likely it's something, it was 4 weeks ago, you had 4 bad days in a row, then you're back to normal. So more than likely something that was swept under the rug, but you can't really sweep things under the rug when it comes to mental health. So that's where it gives the clinician the power to talk about it and work through the certain concern.
How are the users recording their mood? Is it a smiley face, upside down face? Is it numerical scale,
Yeah,
0
it's
to
exactly
10? Or
that. Yep, it's
okay,
exactly that. So it's a
emojis, huh?
Likert, it's a Likert emoji scale. Yes,
All
yep,
right.
yep.
Yeah, I can see that being hugely beneficial. I recently got into journaling myself. I know that there's some days I feel like writing. There's some days where I just do voice dictation. The journaling aspect of it, is it purely word, or is it other expressive methods of determining how that individual feels that day?
Yeah, that's a great question. So at the point of ROSE and the ethos of ROSE, where ROSE is an acronym for recognition of speech and emotion. So currently we leverage text. So text that's entered into the journal for us to pick up semantic tone, leverage sentiment analysis, so we can get a clear picture of how the patient is doing, whether it's financial issues, it's relationship issues, it's stress at work, and that is what builds the ROSE score. But we're also building in speech and audio, so being able to leverage speech and audio so that you can record your journal entry, so that you're able to one, it's an easier way, and also we can pick up more effectively certain things like tone, pitch, and more importantly, the breath, the amount of breaths that you're taking to detect certain mental health symptoms. But what's coming in the future, which is we already started working on, is being able to leverage video recognition for microfacial expressions. So we can look at the entire musculoskeletal aspect. So we can really tell how you're doing, specifically when it comes to substance abuse. We have a good idea of how you're doing. So you can, especially with the millennial aspect and the Gen Z being able to always be on a phone and using clearly seeing the what's happening with TikTok and these other platforms that are really blowing up, is the fact that uh, one, these millennials, I'm a millennial myself, but Gen Z, they are focusing on, they have no issue. One, they have no issue of talking about therapy. They actually, it's more of like a cool thing actually to be in therapy. And it also is an option for them to do an actual video, uh, a video recording or as a journal entry. So that's how we can leverage both the speech as well as the facial recognition to really get a good understanding. And that really is why Rose was created, and the importance of Rose was because when I was going through my burnout, I did not know I was going through these symptoms and the decompensation of stress to anxiety, anxiety to depression. And for so many people, from depression to self harm and self harm to suicide. And that's where the importance of Rose comes in, is that we can detect those things before you even know what's going on, and we have a solution where we can, your clinician can pick those things up before you know what you're actually going through. And that's why I said that Rose is really the solution that could have prevented my burnout. And it goes to show with the stigma as well that males really don't, males have a really difficult time with talking about therapy just because of the stigma. And we're also seeing that certain cultures like Indian cultures, Black cultures, Indian cultures, Asian cultures, that they all suffer from alexithymia, and alexithymia being the aspect of the inability to really express yourself. And that's what really happened to me when I was going through my burnout, was that alexithymia, where we just never talked about mental health. And as a family and as a culture, that I didn't know what I was feeling. I didn't know the changes that was happening was related to mental health. I didn't know that the weight loss was an issue. I didn't know that the poor appetite was an issue. I didn't know that the the Sunday scaries was an issue. And it all led to really going from that stress to anxiety, anxiety to depression pathway.
Yeah, I love where Rose Health is now. Many things you just said really resonate with me. Even as a child, I remember hearing things like "Men don't cry." I
Sure.
still have the voices echoing in my dreams, maybe nightmares from coaches screaming, "No pain, no gain." And even working as a physician, 100 plus hours myself, of when we just never took time to address like these
Of
mental health
course.
issues. I'm glad to see where Rose Health is going to in the future. You're really doing some exciting things. And I would love to bring you on again and kind
Of
of
course.
recap many of the new fascinating services that you just mentioned.
Sure.
Yeah.
Yeah, I would love to. And one thing I also would like to mention too is that we recently brought on a two-time Super Bowl champion, two-time NFL Super Bowl champion, Torrey Smith, who is a former Ravens wide receiver, former
Of
Eagles
course.
wide receiver, and he has been instrumental in being our brand ambassador in addition to being an investor in Rose. So it's great to see that someone of his caliber to be able to represent Rose and to show and to further break the stigma of mental health. Rose is transforming the way that mental health care is not only that Rose is not only that Rose is not only transforming the way that mental health care is delivered, but we're really transforming the way that mental health care is perceived. So we're really excited to have him, and I think he would be a great person to speak with as well.
We would love to have him on the show. I love the direction of where you're going with this. Everything is moving upward and forward. Continue, much success for you and the Rose Health team. Kavi, thank you for taking time out of your busy schedule to be with us on a guest of the show. If people want to reach out to you to learn more information about Rose Health, would you mind sharing where they can go?
Yeah, of course. We really welcome anyone who would like to be part of the roast team or would like to learn more. You can personally reach out to me at Kavi, Kavi, at rosehealth.com. Or if you'd like to download the Rose app for free, you can download it at rosehealth.com/app.
And if anybody missed that, I'm going to have his information on our website. So you can go to the digitalhealthcast.com. We would love to hear your thoughts. Join in the conversation. Let us know what you think. We're on many of the social media handles, LinkedIn, Twitter, Instagram, as well as on YouTube at Digital Healthcast, as well as on Twitter, we're Digit Healthcast. Please feel to reach out to us. That's all I have for you today. Until we meet again.